Welcome to HFMA's 2025 annual conference in Denver. My name is Todd Nelson with HFMA, and I'm excited to be joined by the CEO and Managing Director of GeBBS Healthcare. Welcome.
Thank you. Thank you, Todd, for having me over. It's my pleasure.
Well, we're interested in talking to you a little bit about your company and learning more about it today, and I have a series of questions. And the first one is really thinking about, while AI promises a strong future for revenue cycle management, where is it currently falling short, and what potential downsides must healthcare organizations consider?
Yep. Great question. AI promises a brighter future basis the structured data. And that's probably one of the prominent reasons why AI is falling short today, because of incomplete, inconsistent, and unstructured data, because of the challenges that we have within the healthcare system, heterogeneous systems, interoperability issues, etc. Second is about AI works on complete algorithms, right, in a simple word. And any algorithmic biases can involve inaccurate predictions, and that will result into flawed outcome. As far as healthcare providers are concerned, they should consider the risks that are more related with the data security, with data privacy, the regulatory compliance that we have in a place. And practically everybody seems to be in the rush to implement AI everywhere, anywhere. My recommendation and strong recommendation is AI without human oversight is a problem. One must implement AI with a human oversight. At GeBBS, we kind of mitigate this risk because all our AI-enabled tools and platforms, we use it with the strong data governance, a very robust quality assurance team that is working on the output and the outcome of each work that we do. And we have involved human experts at each and every cycle or stage of the autonomous coding.
MG, thank you so much for sharing your insights. Thinking about the next area of focus, what are some of the risks of automating processes like denial management or coding without clinical context?
Great question. I think I'll focus on two words that you have used. One is risk, and second is clinical context. In terms of AI, that context awareness is very, very critical. And that mostly will come from the clinicians, the RCM executives, and the physicians and the subject matter experts associated with it. I will start with ethics and compliance again. Let's consider AI inaccurately, unintentionally, accidentally upcodes the claim. And if it happens in the large amount, you will have federal investigators walking at your doorstep. Similarly, from the AI perspective, the algorithmic biases that are there can result into inaccurate claims, or it will impact your reimbursement accuracy. At GeBBS, we have implemented AI with the clinical validation checks everywhere, so that the output and the outcome that you will produce is accurate, it's defensible, and context aware. We have to ensure in the healthcare industry that AI is enhancing and not undermining the revenue cycle management.
Excellent. Thank you, MG. With growing reliance on AI and revenue cycle management, how should healthcare leaders address the cybersecurity and compliance risks that come with it?
Yeah. Cybersecurity is critical because AI works on the massive data availability. So naturally, data breach, data security will be a serious concern. And most of the times, the threat actors will either steal the data or they will lock down your systems. If they steal the data, there are legalized way of managing that kind of an incident and reporting. But when your system locks down. Your entire patient care and the treatment and whatever happens with the patient in the hospital or a health system becomes a primary concern. Best way is to protect your network. Establish strong data and security governance frameworks and go for maximum amount of certifications that are possible. Secondly, develop a strong incident response management system which will allow you to identify, to contain, to eradicate, and also to recover from the incidences rather quickly. And do periodic audits on your network, on your data systems, so that we do ethical hacking on our systems, right? So in GeBBS, what we have done is across all our applications, processes, and systems, we have followed a combination of several standards and certifications along with the strong governance framework. So we have NIST, we have HIPAA, we have High Trust, we have PCI DSS, and we have SOC 2. That kind of a certifications and controls allows us to go in front of our client and say them innovate with us with confidence.
So MG, thinking about the last question for our time today, what are some of the best practices that providers should use to effectively integrate AI into revenue cycle management to ensure its long-term success?
Yep. AI is critical and important at the same place. But my recommendation is always don't fall for the hype, right? Identify and establish the critical use cases that you have within your organization and execute them with a proper system integration. Second also is AI is not about once done is always done. You will have to keep improving about it. And that's why I keep saying that AI, artificial intelligence, needs to be coupled with human intelligence. You cannot underestimate the inputs of and the context awareness of your revenue cycle management teams as well as the clinician inputs. And fourth thing is establish on a strong data governance as far as AI is concerned. At GeBBS, we typically believe that artificial intelligence will enhance but will not replace the human decision making. So you have to use artificial intelligence in such a way that it enhances your efficacy rather than replacing humans.
MG, thank you so much for sharing your insights today and for GeBBS to be a part of this session. I learned a lot and really appreciate your support.
Thank you so much for this opportunity to interact with you.